This is Dr. Philipose over at Ventures Clinic, and I'm going to be explaining how I do a simple treatment for patients that suffer from disc bulging, disc herniations, or any type of sciatica that may be resulted from those conditions going down the leg. So primarily, we'll look at MRIs, we'll look at x-rays, and when we isolate exactly which vertebra may be kind of affected from it, I'll utilize different treatments such as decompression therapy, as well as things like dry needling, and in more severe cases, we do a type of regenerative type of therapy called prolotherapy or prolozone, which will help grow tissue around the arthritic area and help stabilize the spine, and then show you specific exercises and stretches you can do to help you out. So typically we'll kind of palpate, and a lot of times patients will have it in the lumbar spine, especially in the L5S1 or L4L5 area. We'll evaluate for degenerative disc or spondylolisthesis. I'll also check for any type of SI joint instability and see how the pelvis kind of rotates. So once we kind of isolate it a little bit, I'll usually start by a little bit of dry needling if possible, or some light stretching prior. But I'll utilize a tool like this, and so we're not doing a lot of heavy rotational type of movement. And once the vertebra is isolated, we'll actually treat it and then reevaluate to kind of make sure that that problem went away. And a lot of patients will actually have issues with their hip flexors as well. And so we'll kind of palpate and kind of see which angle we need to kind of approach it from there. So, low back pain is very common. Disc bulging is a side effect of chronic type of pain where the pressure accrues in the spine, and you just want to make sure you treat this ahead of time before it does herniate past a certain point or even rupture, because at that point it is surgical and you just want to avoid that as much as you can. So you can visit us on the web at venturesclinic.com. You can also go on YouTube and see a lot of our videos. And you can also call me personally at 405-848-7246 for more information.